Welcome, everybody. It's Dr. Douglas Pernikoff of Dr. Doug's All Things Animal Radio Show. Normally, I have my wonderful co-host, Cindy Vickers, here, but she's running a few minutes late. I think there was an accident on the highway, I was told, so we should have her join us in just a moment. So today we had a guest that was coming in, and her schedule got changed, and we had to kind of be creative. So today we're going to just have an open a kind of free-for-all kind of session that we're going to call not a potpourri of animal topics, but a pet purry of animal topics. And I think that's so clever. Well, maybe you do, maybe you don't. But anyway, I think what we'll do, we're going to open up the phones and we're going to try and see if we have any general question areas. So, hi, this is Dr. Pernikoff. Who am I speaking with?
Hi, my name is Lori. I recently acquired a mini pig, a potbelly pig.
Oh, okay, good.
And he is now 4 weeks old.
Oh, wow.
I have been giving him this formula that simulates goat's milk, I believe.
Right.
And I am feeding him 3 to 4 times a day, 6 to 8 ounces.
Do you know how much he weighs, Lori?
Yeah, I think he weighs almost 4 pounds.
4 pounds. Okay, so we normally would suggest like 14 to 16% of their body weight divided into X number of feedings. So probably every 3 to 4 hours is good. So you want to do about 1 to 2 ounces, 1.5 to 2 ounces every 4 to 5 hours, I think would be adequate.
Okay. I think we're overfeeding him then.
Okay. Well, if he's taking it and he's not regurgitating or having any problems,
no,
so that's fine.
I was just afraid because he just always seems hungry, but a pig is a pig, right?
Well, I mean, that's why they call them pigs.
Right? My other question was, he just has this rooting issue where he wants to root, and I've tried to redirect him using putting a stuffed animal in between us. Is there any other? Well,
he's a man after my own heart. I'd be rooting on you too. But the reality is that I think he's pretty young, and you got him pretty young. It sounds like.
We did.
So I think he's probably just mimicking behavior that's kind of programmed into him as he's trying to approach his mom and encourage an opportunity to feed. So you might have to tolerate some of that. It's probably going to really bond him to you very well, maybe obnoxiously well. But
right.
I think
it's already started.
And I imagine that you're probably going to spoil him too. So you should be having an interesting pet relationship as this guy matures. Mm-hmm. So you have to learn to give him some independence, so he doesn't think you're the gig, and he won't accept anybody else.
True.
Do you
have time for one more question?
Sure, honey. Whatever you want.
What age would you suggest that a potbelly pig be neutered?
My attitude is if you can grab them, you can take them. So I would suggest that he's going to need some vaccines too. So you probably want to get in 6 to 8 weeks is probably a good time to start thinking about getting him for his first vaccines. And then your veterinarian can give him a good exam and then to determine when the time would be good. But usually we'd do it about 6 months of age.
6 months? Okay,
yeah.
But he does need to be seen at 6 to 8 weeks?
I think so. I think it's important to start a vaccine regime for these guys. And there are certain...
Okay, and do you see mini pigs?
I do. Well, I don't see many of them, but a few.
Mini pigs.
Mini pigs. Yeah, we see them all the time. In fact, our clinic, we've actually typically raised one every year or every other year just in the clinic just for fun because they're amazingly bright animals and they're just sweet. And have you had other pigs?
I do. I have 2 that live outside that we got when they were older.
Is one of those your husband?
Baby. No.
I guess that wasn't a fair question.
No.
Yeah, they are wonderful. I really think they're an amazingly bright animal, and I think they fit well into pet homes. And more, we had one person in the show some months ago that is involved in all this community kind of suburban farming and suburban pets. Mm-hmm. And nowadays, a lot of communities will accept the pigs kind of like they accept dogs. So,
right.
And that's something I always tell people, make sure your community knows that you have it. You let your neighbors know so that they don't give you trouble. And if you have any acreage, you're probably fine.
Okay, thanks so much.
Okay.
Bye-bye.
Bye-bye. Okay, we have another caller here. Let's open the door. hear what she has to say.
Hi, my name is Jeanette. I rescued a dog a few weeks ago
Okay.
from 5 Acres Animal Shelter, which they are great.
Congratulations, by the way.
Thank you.
We appreciate all rescues.
But they said they rescued him from the Boot Hill of Missouri,
Okay.
and they pulled over 100 ticks off this poor animal.
Oh, wow.
And some of them were about the size of a nickel.
Wow.
And his sister actually contacted a disease and died from it.
Oh, really?
So I was curious if there's any warning signs or anything I should be aware of that maybe could show up later because of...
You know, your veterinarian can actually do a very simple test in the office if he has that test available, or he can ship it out to the laboratory. But you want to ask him to do a tick panel analysis or use his heartworm test if it's diverse. Some of them will include other agents that can cause disease that are transmitted by tick bites. So I always do that on annuals. And if you find something like, there's one called anaplasmosis. The most common thing we see here in Missouri is ehrlichiosis. And another one that everybody knows about is Lyme's disease. Is not really present officially in Missouri. But you can have these blood tests that'll tell you whether there's been exposure, and especially since he's come from the Boot Hill down, I guess, near Tennessee and Arkansas borders, there might be exposure that you wouldn't see elsewhere in the state. So that would be the first thing. Find out the test. You'll find out if there's a positive for any of those concerns. And then you can treat them, or your vet might treat them just prophylactically with some doxycycline, which is the same drug they use in humans. And I would preventatively, with that history, I would preventatively start treating it if you were my client. And that'll be something you have to work out with your veterinarian. And then note that if you do have a positive like ehrlichiosis, you will always have a positive test thereafter. Doesn't mean that you're clinical. It just means that you've been exposed to the agent. So clinically, what you see, these particular agents tend to attack blood cells. And when they do that, they affect the immune system, they weaken the animal. And a lot of times all we see are fevers, chronic recurring fevers. They can have joint acheness and just being lethargic and quiet. So if you see character that's abnormal or unusual, that's good reason, especially with that history, to get to your vet, let them determine if you have these problems. But I'd probably jump ahead and be proactive, okay?
Okay. Yes, sir.
I think you'll be fine. And thanks for adopting. That's wonderful.
Thank you very much.
Okay, have a good weekend. I guess we have another interesting call. We got lots of calls today. Let's try somebody else and see what line we have.
Hi, this is Doug from West County. How are you today, doctor?
Good, Doug. What can I help you with?
I've got this mixed breed dog. He's about 8 years old, and he has a serious compulsive issue with his Frisbee.
Okay.
And he just wants to play with it all the time. And, it's getting crazy. So if I put it away, he's looking for it. If I'm playing, he never plays enough. We play so much that he ends up getting sore and arthritic.
Okay.
So any suggestions?
Yeah, I think the big suggestion would be to change your activity opportunities and do something else and get some other kind of toys and change the play schedule so he's not committed to that particular toy that he loves so much. And then give him some
that, huh?
Huh?
Dilute it.
Yeah, dilute it, and you can still do the Frisbee, but don't let him think that's the only opportunity to play. He's probably enjoying the interaction with you as much as he is with the toy. So I would say a good thing to do is just kind of schedule it out and say, okay, in your mind, you're going to do Frisbee this day 1 or 2 days a week, and the rest of the time you're going to introduce new toys and new activities. It could just be a walk, with the dog, or it could be just exploring a different setting.
All right, that sounds like a lot of fun, and thank you for your advice.
Okay, anytime. Call us back again, and thanks for listening. Well, we've got a couple more callers, so let's see who we have online. Hi, who am I speaking with?
My name is Mary. I have a friend that was bit by a cat in her neighborhood.
Okay.
They think it was a neighbor's cat, but they don't know for sure. The neighbor said that it wasn't vaccinated, and now they can't find the cat. It's an outdoor cat, obviously. And she wants to know if, in 3 weeks, she wants to know if she should get a rabies shot or a series of rabies shots.
Okay, well, that's a good question, and it's a concern we hear all the time. Rabies really isn't that prevalent in Missouri, thank God. We get probably a couple of reports a year, if that much. But I would tell you that the best thing to do is, first of all, verify that the cat has had its vaccinations up to date. And depending on whether it was a 1 year or a 3 year rabies, you can do either, but you need to know for sure. If it has, then you're cool. You just need to talk to your doctor about updating your tetanus if that's necessary. And if the bite is bad, obviously it has to be treated. Cats carry a lot of interesting bacteria, and they can cause some pretty nasty infections. So the best thing for you to do is to get to the doctor, talk to him. We'll probably want to put you on some antibiotics, and I bet that's going to be very, very good for you and very adequate. But watch that. If that wound gets nasty, stay on top of it, okay? Because they can be really nasty. Okay?
Okay, yeah.
Now, in the event that there is not a active or up-to-date vaccine history, then you might have to talk to an infectious disease person. I think nowadays the shots, they used to have to do like 14 shots in a series for potential rabies exposure, but nowadays I think it's only a 7-shot series. And of course, you don't want to have to do that if you don't need to. So of course, we want you to find out if you can grab that cat, or at least talk to the owners and find out if the vaccine history is up to date. Okay?
Right. Okay, sounds great. Thank you
Thanks so much. Talk to you soon. Well, we have one more caller. Let's open the phone line. And who are we speaking with?
Hi, this is Rose.
Hi, Rose. How are you, honey? This is Dr. Doug and my wonderful co-host, Cindy
Vickers.
Hi, Rose.
Just slid in.
What kind of question? What do you have that's going on that I can help you with, or we can help you with?
Okay, well, I have an old cat. He's like around 17 years old.
Okay.
About how much longer will he live? And currently he's getting dry food and wet food. So when I give him the wet food, I cut it back to like a couple of tablespoons, because he seems to like wolf it all down and then go throw it all up and then eat it again. And it's getting really old.
Yeah.
Yeah.
That's my professional response. Well, first of all, the first part of your question, I just spoke with God, and he said that your cat will probably live another 18 months to 24. So
and I marked it on my calendar.
I wouldn't, God never lies, okay?
But should she mark it on her calendar? Like
do we
have a day or anything, a day and a time? So
I think it'll be about 8:13 a.m. on whenever that is, 24 months from now.
Thursday morning, probably. That's
but no,
the I'm getting.
Nowadays our cats are actually living up to 20, 22 years. I've had one 23-year-old cat that came into the clinic. It's pretty amazing. Our science is better, and more importantly, our healthcare is better, and our nutrition is better. And I think all these things are, providing for longer pet life, which is great for the owners and for the pets. So it's a functional cat, right? I mean, he's happy, stays inside, and responds to you?
Yes.
Okay.
Yes. Oh, he definitely responds. He follows me around constantly and meows.
Okay.
You sit down, he sits on your lap, he lays on your head. Oh, yeah, he's very affectionate.
You talking about your husband or the cat?
I'm talking about the cat. I don't let my husband do that. Yep.
Well, you started to say that the issue with the cat just vomiting his food every day is getting old, which I completely can understand. And I would suggest that maybe you continue to just give him the tiniest little portions and see if that in and of itself solves that problem. Because if it doesn't, then maybe you have to start looking at some other things. That is my veterinarian
that was very good.
An opinion.
I was going to say the same thing. So what she's saying is more frequent feedings, smaller amounts, and if you're still having a problem, there's a lot of other reasons that a 17-year-old cat could be having a regurgitation or vomiting problem. Well, thanks for calling. We really appreciate it, and I hope everything works out. And again, congratulations on a 17-year-old cat.
Yes,
that's really good.
Ditto for me.
Okay.
Wonderful. Okay, thank you.
Well, thanks to all our callers, and graciously, we have Cindy is back with us, and of course, she participated in our last caller, and it's great to see you, Cindy. How are you, honey?
Well, thank you. I'm doing very well, and I apologize for being late, because I don't like to be late. People who know me know I think that, well, I say I don't like to be late, so I had a very legitimate reason. That traffic was backed up on 40.
Okay, audience, you guys can decide whether we should punish her or not. I'm going to let it up to you. But I'm okay. So we've had a good session of discussion topics. We're going to come back in just a moment, and Cindy and I are going to continue to talk to each other and kind of catch up. So we'll talk to you in just a moment. Dr. Doug's All Things Animal radio show, Cindy Vickers and Doug Pernikoff will be back in just a moment.
Where are you? We got some work to do now.
Well, here we are again in our second segment, and Dr. Doug and Cindy Vickers at Dr. Doug's All Things Animal radio show. And we're just going to open our own discussion to one another and talk about interesting topics. And we were going to start, I think you had some questions about reproductive biology in pets, right?
Yes, I did, as a matter of fact. Well, I was listening to a different radio show this morning, and the topic was testosterone for men. And I want to know, does that ever go? I got the look.
Does this have anything to do with your new boyfriend?
No, absolutely not. It has to do with, does this conversation even seem relevant, or does it ever come up in the animal world, like estrogen and testosterone? And
well, yeah, that's actually a very good question. Estrogens, when they're deficient because they've been spayed, they actually will cause problems with incontinence in older female dogs. So that's part of the reason the supplements are either estrogen or estrogen-like, and it causes contractility and firmness of the muscles.
Oh,
of the
contractility.
urethra.
Oh, God, that's the word for today.
Today's word? Okay.
Mm-hmm.
Do you want to
There's always
repeat
a word.
It?
Well, contractility, and I can spell it, by the way.
Oh, wow.
In case anyone cares. Call in if you need the spelling. You can always look it up.
So we don't have as many problems with the testosterone issue really comes into play when we don't neuter our dogs, because they can have problems like down in life, prostatic enlargement, which can cause problems like incontinence or chronic prostatitis, just like in humans. And also sometimes there's a higher incidence of retain, if the testicles aren't dropped, they can become cancerous, or even the ones that do drop normally can become cancerous in older animals.
An orchid problem?
Yes. Oh, my God.
I know. I'm trying to impress you. I am trying to impress you today.
Oh, my God.
And then if you need to, you can get those nudicles.
I know. But, you have to cook them for a long time before they're any good, but I don't know.
Who does that? Does anybody? Is it for anyone who, first of all, who doesn't know, you can get these fake testicles for your dog.
Like the fake news?
There's words that are similar there and fake, but you could actually have the fake testicle implant for your dog. This is real. This is for real. And do you know anybody personally? Have you ever done it? You carry them in the clinic?
Mine are still real, but
not
no. People talk about it all the time, but I've never seen anyone actually pursue it. And the funny thing about neutering dogs, is that the males, the husbands, are the ones that resist it.
Right, I do know that.
And it's like a real issue, right? And then I wanted to ask you in that same question.
There should be no question coming to me that's
in
any way related here. Oh, okay.
So, of course, what are the male, I'm testing you really, what are the male behaviors that we would like to kind of curtail by neutering?
Okay.
This goes for humans and animals alike.
That's why I recommend it for all the boys I know. Well, the higher levels of testosterone, so the testosterone levels drop when the dogs are neutered, correct?
Right.
Okay. So testosterone is linked with higher aggression,
right, and
more marking your territory, and that aggression sometimes turns into just making a dog who cannot who doesn't work well or play well in a dog park, that can't go to daycare. So there's a lot of people who have restrictions on dogs that are not neutered, and it's any place that there's a lot of dogs that are together, like a day camp or daycare or boarding. So just that would make your life easier. And also there's the potential prostate issues that come down the line. But I think when people are having dogs that are just more aggressive, and I think that's a big reason, just to have a dog that can get along and play well with others and not constantly mark their territory. Because even a housebreaking...
be climbing on another animal or a human, that's just kind of obnoxious behavior.
It is obnoxious behavior, but even a housebroken dog will walk into a strange or a new environment, like just maybe you brought him to a friend's house and the dog just lifts her leg, and that's just all about marking, and it's all about testosterone generally.
One more behavior I was going to mention.
But one other thing is that you need to have them neutered early. You can't wait till they're 4, because then those chemical levels don't, or those hormone levels don't really change very much.
Well, I think the hormones change, but I think their behaviors are kind of
pretty ingrained.
Planted.
Okay,
right.
let me pretend I didn't say that.
Okay.
That's learned behavior now.
Right.
And
exactly.
It doesn't change very much.
Well, one other part of that behavior is that dogs that are intact go roaming more, and there's a lot of problems with those dogs getting loose because they can tell when the females in the area are in heat, so they're going to go exploring.
And apparently it's at quite a distance that they can detect that, and they get busy. They have places to go and people to see. And dogs that will jump fences like you can't believe to get to another dog in heat.
Right.
So that's also one of the many reasons to spay your female. Right. I think it's assuming a lot to say that we should deal with the females but not take responsibility for the males who are, impregnating them. I'm going to get on my soapbox now, and I'm going to have to, call Gloria Steinem. But I really think that it's, important to look at both of them.
Well, don't forget that, one male can do a lot more damage running around the neighborhood breeding than one female isn't going to do that. Cindy, this is really interesting that we've been talking about the reproductive biology. We just had a litter of, actually my technician had a litter of the little French bulldogs that I love so much. And we had we had 4, they're all healthy. Then we just started feeding solid dog food, was mushed up and everything. And one of the dogs we noticed started to kind of regurgitate. And then thinking retrospectively, it was the one pup that was kind of draining through the nose every once in a while in the feeding. So
it's got an open...
Well, we checked for any kind of malformations of the mouth. That didn't exist. So then we got scared because he started having with more of the solid food the last couple of days. He starts really kind of straining, almost like he's choking, and he's losing his air. It's really kind of scary. So today we took an X-ray to see what might be going on. And just to let the audience know, these puppies, even in the best breeding situations, can have lots of little things that come up that have been hidden in their genetic code, right? And we believe this little puppy has either, there's a disease of the esophagus. It's called megaesophagus, and that happens when the nervous component that normally controls a normal esophagus, when you eat food, obviously it goes through contractions, all the GI tract, right, and it moves it down into the stomach. In this case, we saw, and we put some barium down to notice this, but we saw that the esophagus was a little bit distended. Now that can be its own problem, but there's another interesting problem that can be formed, and that's called a persistent right aortic arch syndrome. And that's when part of the anatomy and the blood supply that's coming and managing the heart when the baby's inside the womb is present, and it should disappear. But when it doesn't disappear, it persists. Okay, and this little bridge of vessel can constrict on the esophagus as it's going through the chest towards the stomach, and it actually makes it difficult to swallow food.
So is this something that happens because they are so tiny that something from their heart or their chest can move up so high that it touches their esophagus?
Think about it. The esophagus and the trachea, they kind of go down into the chest from the throat, and the esophagus keeps going, right? And it goes through your diaphragm into your stomach, okay? So what happens is on its coursing through the chest, there's an area that would normally be open and available, but now because of I would call it the neonatal or the premature, the baby in the womb has structures that allow it doesn't need to swallow, right? Because it's not eating.
So is that the thing where that's the epiglottis? Is that what has to close? Is that on the...
No,
never mind.
No.
Okay, carry on.
Bottom line is that I guess the message to people is that you get these little puppies. Don't be surprised if they come up with problems. It doesn't mean that you have a bad breeder or a bad source. It can be that it's just something that's genetically present. And that's one of the problems that hit us, with my technician's dog. And it's just kind of sad because now we have to think about doing surgical repair in order to salvage this puppy.
And people, I really wish they would think about that before they decide they just want to breed a litter because they think it would be cute or fun, or they have two neighbors that want it, or nobody that wants it. They just like their dog.
Right. It's a difficult question. I know you and I have talked about this before, but we have rescue. We do our own vet pet rescue. I really encourage people that rescue pets, but at the same time, we've all grown up loving any dog or any cat, and I love purebreds too, and I love Frenchies. So it's hard for me to say that this is a bad thing to do, but it has to be responsible breeding. Otherwise,
well, I'm talking about backyard breeding. People are just thinking it'd be fun.
Right.
I mean, there's a lot of things that could happen with a litter of puppies, including trying to place them. And what people don't think about is when they place a dog, and then the dog is 6 months old and they're not so cute anymore, and they're at a kind of a difficult stage where they don't want the dog anymore. And responsible breeders take their dogs back. So you have to sort of think that you might be willing, if it doesn't work out, you're going to take that puppy back just when you thought they were all gone.
Well, some of these puppies, actually, if they have something that's more serious and people don't want to put the money into fixing them, they get euthanized unnecessarily. So that's another issue. That's
or even if it was necessary, that's a very difficult thing to do. Yeah.
Oh, so I don't know that it's a good kind of topic to discuss over and over again because people get lax about this and they forget about.
Okay, so in your vet opinion, what is the most amount of litters that any one dog should have, and how often is safe?
Well, real quickly, and it really depends on the size of the dog, the breed, the purpose of the breeding, and all that stuff. But I don't think anyone should be bred for at least 3 cycles. Going through heat at least 3 times. That gives them enough maturity that they can physically manage it. And then if it's a proper breeding and the animal's healthy, I think you should skip a cycle at least. And I don't think you should breed more than 3 or 4 times in the lifetime of a matured female dog. And of course, with the male, it's a different game.
So are you saying maybe once a year if you were going to breed a couple of times
if you were going to breed 3 to 4 times in the life of that animal, then I'd say maybe once a year, every year and a half, every 6 months is when they're going to come in heat. And that's a good question. We're going to stop for just a moment. We'll be back and discuss more. This is Dr. Doug Pernikoff and Cindy Vickers of Dr. Doug's All Things Animal Radio Show. We're happy to have you as our guests.
We can count on you, Scooby-Doo. I know we'll catch that villain.
Okay, gang, we're back. Cindy and I have been talking general topics. We've talked about sex and dogs and cats, and then we moved on to puppies and birthing and all that stuff.
Let's keep a timeline going then.
Yeah, so now I think the next thing is how do we train our puppies? Where do we start? What do we think about? What are the responsibilities? And what's the cost?
So you're asking me. So how about when do you even get the puppy if you could get the puppy at an ideal time? So we're not talking about rescuing any dog that needs to be rescued. We're saying that you have the ability to make that choice. So there are some folks who say that 49 days is the day that you should get them.
49 days.
49
days. Divided by 7. That's about 8 weeks.
7 weeks. 7 times 7?
Oh, it's 49.
But in other math cultures,
great minds.
Sometimes it's different. So some people say that's actually the perfect day, but generally speaking, I think before 7 weeks is too young. 7, 8, 9, 10 weeks even is fine. I think 12 is really far if you want to get a new puppy. And the really big thing when you have a new puppy is you want to be protective while highly socializing them. So you don't want to have this puppy, and it's really somewhere around 8 weeks that they have this socialization period where it's imprinted. So if they're in an imprinting phase and you drop a book on their head, They won't get,
wouldn't do that.
Here's a test that they did with puppies who were about 8 weeks. They had a little electrified wire. I'm not saying it was horrible, but they encouraged the puppies to come across it. And they did it at 8 weeks, and they did it and also with puppies who were like
Was
11.
this in Auschwitz? Or where
11
was this?
weeks. No, but the puppies who did it when they were 8 weeks could never be encouraged to go over that line again. The ones that were a little bit older didn't like it, but they could be encouraged to go because the younger ones have it imprinted. So even though I'm saying imprinted, sometimes those things can be improved.
Right.
So they're not maybe like imprinted in concrete or something that doesn't,
Is that breed specific too? I mean,
no,
it doesn't really matter.
No,
Okay.
it's just a puppy thing. So I think it's really important that you do things like just be careful with how you handle them and realize you might have a wiggly puppy, to put them down on, it sounds silly, but put them down on the floor carefully. When a new noise, a new person, a new environment comes around, you want to just keep your talk very happy, so that the puppy's information is it's very happy, but you just have to protect them from really getting really hurt. So things should sort of be eased into their life, and you want to do it with this kind of upbeat thing. That and getting the dog housebroken really are I think the most important things, but you cannot miss that socialization. Once they are safe to go out, you've got till they're about 16 weeks to get them out and get them socialized, or you've missed it. I mean, you missed it.
How about before that time, they're going to have issues with biting the kids and stuff. I always tell people in the vet clinic, the puppies are going to look for an authority figure, and they're going to take advantage of anyone they can as like a sibling in their litter. Is that true? Or?
Well, one thing about this puppy biting is it really, really hurts because they have those needle-sharp teeth. So there's several things that you can do, but the first course of action is to just give them something that can be theirs. And you can say, really make a sound. You could hear this. You try. You make a sound like, ow! And some puppies are just horrified when they hear that, and they try not to bite again.
Scares them.
And it takes them a couple times. And I don't know if they're more sensitive. Other puppies could care less. So that's one of the ways you see what kind of temperament you have in a puppy, to how they respond to that kind of thing. So first protocol is if they bite you, you make that kind of sound, or you could even say no, but give them something they can have and praise them for having the toy that they can chew on, or whatever it is that they're allowed to bite on. Another thing that you can do, this is a little time consuming, if they persist and you have a dog that is social. So we're not talking about dogs with a more unusual behavior and more difficult behaviors who are not particularly connected with people, but dogs, your golden retriever and your Frenchie and your poodle do not want you to leave them. So what you do is you just get up and you walk right out of the room. Like you bite them, you get up and walk, remove yourself. It's sort of like putting them time out, except you take yourself away because you can't easily put them in timeout, and be very, very persistent with it. Give that, even 4 or 5 days, and see if that makes a difference. Because if it does, it's a fairly easy fix, and you don't have to get more physical with them. So there's some corrections that can be made, and there's schools of thought with people who don't agree with that. But I think if you removing yourself from them doesn't impress them as a punishment enough that they would choose not to bite, and they can make that connection, then you might have to go to something that's a little bit more
physical or on hand.
Not like a big 2x4 or anything.
No.
That'd just be too much.
Well, that was one of my questions because
2x4s and puppies.
I'm sorry?
Using a 2x4?
No. I'll have to tell you a weird story with a trainer years ago that I couldn't believe the way he managed animals. But I was just thinking that in many cases I'll tell people if the dog is biting the kids or whatever, to displace that behavior and take control. And I know even when we had that trainer out of Sturm here many, many months ago, he talked about, when is it right or is it ever correct to kind of make that dog, put that dog down. Just put him in a submissive position or hold him. What I tell people is if they're small enough, just cradle the puppy, take it away from that space and just hold him and just say no bite. And then you don't have to punish him, you don't have to slap him, but to take control and kind of displace that behavior with a new direction. Does that make sense?
If that works, but putting a toy in their mouth is displacement.
Yeah.
So if that doesn't work, you can just weigh that out. If it does work, fine. If it doesn't work, what I want to say about when things work, you can't just necessarily do it one time and say it doesn't work, because they have to be convinced and they have to understand the connection. You have to realize they don't always get. You might be doing something in your mind that says don't bite, but the puppy may not have made that connection. So you have to give them time to make the connection, and then you can see what could work. But the whole alpha rollover thing is supposedly based on what wolves do, except wolves don't do it. So it's just misinformation. But I do think you can do, I've done this, and it is kind of old school, but I still like it, where you have the positions that you put puppies in to do a little bit of dominance training, and I've always thought that it was very. I know it, but I still. I read, believe me, but I still think it's really, really effective. I think it's good for the puppy to see that in a way that causes no physical harm to them, that they have to submit to you, and for me, and I've done it so many times, then I watch it immediately change that dog's opinion right then and there. So they look at you differently and it's a really lovely way. They just go, oh, okay, I think I'm going to I think I'm going to listen to you. So it just says, this is the way it's going to go. I'm not going to hurt you, but I'm also not going to give up. And then because they've learned that with you doing very little, that you absolutely could control them if you needed to, they don't challenge it as much when they're older, and you would have to, where you don't want to have to do what you would need to do if you had to get your dog to submit. Not necessary.
So I've seen another situation that always perplexes me, but you can speak to this. So in the course of my 30 years working, I've probably seen every once in a while, maybe every couple of years, I'll hear a story about a dog that is showing a lot of aggression. And I always think, okay, that dog probably came from an unusual background or something. Turns out I'll ask, and they'll say, no, we've had this one since it was a new baby, new puppy. And I'm thinking, well, is that something that is inborn and kind of built into the genetic code of this puppy, or is it the way he was managed as a young puppy? And why did he become even aggression towards the owners as well? Is that because he developed knowing we could get away with, or is there something just built into some dogs are going to be aggressive?
Well, I think that there are dogs that are genetically unsound. But so many times I have seen, I've gone to people's homes and I don't know what happened. I put the dog on the bed and the dog bit me, and they think that it came out of nowhere. But when you can get a little bit of information, you can see there were many, many things that happened along the way that changed the course of how this dog was going to turn out. And the people just didn't know how to read that or what to do about it. So until it's a bite, they didn't see all the other things. One example would be, he just, when he's got his favorite toy, he kind of really protects it, right, and he growls. So we just leave him alone. Yeah. And so now the dog is learning, well, that works. Yeah. I can protect, I can growl.
It's like enabling a child.
Yeah. So what they do is they just take it up one more notch, and then one day it's the thing that's become so valuable, and the growling didn't make you go away because the people don't even get it, and the protecting didn't make you go away. So they're like, well, now I'm going to have to bite you.
Oh, wow.
And then it's a train. It's like they get hit by a train. They never saw it coming. But usually there's
so you're saying that it's probably as much operant conditioning as it is in genetic makeup of the animal.
Well, I'm so excited that you said operant conditioning, because it really makes me feel like you're the behavior vet. I'm saying it's quite possible that it could be. So are you going to keep one of these puppies, by the way?
I don't think so. I was told that if I brought another pet into the household, that I'd probably need a new household.
Yeah.
For me, not for anybody else.
How many pets are in your house right now?
Now we're actually pretty good. We only have 4 dogs.
That's it? No, not a spider or mouse
spiders,
or anything?
but I didn't think about those. Yeah, of course we have spiders.
Mice?
Well, we do have some mice. I saw them running through the...
Not invited guests, though?
Those are uninvited
Uninvited guests.
So, but that's the beauty of owning your own veterinary clinic, because then I can take all the snakes and everything. They're at the clinic. And then I have other people take care of them, but I get to play with them. So, yeah,
it's play with a snake?
Sure. Doesn't everybody?
What's the weirdest thing you have in the clinic right now?
Me.
Besides you, a given. But
we still have the swan that we're still trying to work on. That's kind of interesting.
Is anything positive
we've got
happening?
We do. We have somebody that wants to take it and start working with it, and we're probably going to move that way. But it's been great, because otherwise it would have just been euthanized. So I think we're just about run out of time for this segment, and we're going to come back and do our close-up. And I think you said you had some events to share with us.
A couple.
Okay,
couple
good.
I might like to talk about.
So Cindy and I will be back, Dr. Doug's All Things Animal Radio Show, in just a minute. Thank you again for listening. Welcome back, guys. We're here in our fourth segment, and it's our follow-up kind of recap segment. And Cindy and I have had fun talking to one another because nobody else will talk to us.
Good point.
And we, as I said, we did have an interesting guest. We'll try to get her on next week. I'm not even going to tell you what the topic is, but it'll be fun.
She is interesting. I can vouch for that.
Okay, there you go. See, like my word isn't good enough.
No, I just wanted to support it.
Okay, good. So we had a good show. I thought it was fun and different. We had our wonderful phone callers that asked us questions from their heart, and we tried our best to answer them, or at least confuse them. And then Cindy came in late, so she's got a little tardy thing we've got on her, and she's going to have to make up time. So even though the show will be over, she's going to be here for about another 15 minutes just standing here.
Washing dishes.
And then we had some good discussion on sex and pets on up to puppy training. And I appreciate Cindy. If anybody needs any training, you call us to find Cindy Vickers at 636-530-1808, which is the Clarkson Wilson Veterinary Clinic. And where I exist most of the time, you can get me at that same number or www.clarksonwilsonvet.com. And again, I think Cindy has one or two little events to share with us.
Yes, a couple events. One thing, we mentioned this last week, but I think this merits repeating. Jungle Boogie goes on at the zoo all through August. I think September 1st is their last
What
time.
is that again?
So
is
that's when
bands or?
Yeah. It's a big party and there's music, and I think it's a really, and the zoo is so pretty, and they got all that all those new things. And
well, when you go in there, and it just feels like when I was there as a student and a worker, they didn't have all the growth and all the, they planted the thing up. There's paths.
Yeah, it's gorgeous
pretty.
now. So our friend Mr. Bircher told us how beautiful it is. So I think go check out Jungle
No, he was
Boogie.
talking about you.
I don't think so.
Yeah.
I don't.
Oh, he
think
sent me a text
so.
afterwards. He said she was
Lord,
beautiful.
Have mercy. All right, then at Purina Farms, I seem to be very hot on Purina Farms all the time, but the Jefferson County Obedience and Rally Trials are there August 11th and 12th. If you if you like dogs and have ever even thought about training a dog, or are thinking about you want to get a dog and you're wondering about different breeds, this is a great way to kind of look at different breeds and what they do and how they move and perform. And watching obedience competitions and rally is a sort of a really fun athletic obedience competition. So there's two things going on. I think it's incredibly fun. So
Plus, you get to talk to people and learn. If you
just don't talk to them right before they go in the ring, then they're cranky.
They don't want to do that.
But it's so much fun to watch. Just if you like dogs or you're thinking about getting one. And then also one of my really favorite pet stores is Four Muddy Paws, which is in Lafayette Square. They also have a place in Edwardsville, but they have this Get Fit with Fido on August 11th. It's at 6:30 at 7:30. It's $10. You're supposed to bring your yoga mat, and they're going to do it again on September 1st. So I don't even know what that looks like, but I know it's generally a really fun store and a cool place to go, so it might be worth going just to hang out. And then Four Muddy Paws on August 12th is having an adoption and a social hour.
Very good.
I think it's also at 6:30.
I think you had me at an event
positive.
there. It was a lot of fun.
Yeah, we did a fundraiser for Loosen the Leash.
Yeah. So again, a lot of interesting stuff coming on, and I agree. I like to go to cat shows, and we don't have much time to talk about it right now. But
There
I always
is one
find
coming up.
Is there
too.
really?
I didn't.
Find out for me, because I think they're so much fun. They're different than dog things, but you get to see these unusual breeds you don't always see.
That's for sure. That's what they had. Of course, I don't remember where, when, or any of it, but I do remember I saw a cat show, and they listed some of the breeds. So that an Abyssinian isn't even the most unusual breed.
Yeah.
If you could ever see these hairless cats, they're so fun.
I love them.
I do too.
Yeah, and they're soft.
And then the big, gorgeous Maine Coons and.
Yeah.
So
that's great. I agree.
We don't know where it is or when.
We don't know where.
So I'll tell you how great it is. We just don't know.
That's the way we get you to come back and listen to the next show.
Yes, listen in.
So thank you, everybody, for listening. Dr. Douglas Pernikoff and Miss Cindy Vickers of Dr. Doug's All Things Animal Radio Show. And we will see you next week.
Adios.